Your blood work comes back perfectly clean. Your doctor says everything looks fine. But you pull down your collar in the bathroom mirror and count a dozen new little growths that were not there last year. And 6 months before that, they were only 3. Here is the part nobody tells you. Those bumps are not just a skin problem. They are a signal, a quiet, persistent message from your immune system that something underneath has shifted. And if you keep treating only what you can see, without understanding what drove it there in the first place, you will be fighting a battle that never ends. My name is Dr. Walter Strong, and over the course of this video, I am going to walk you through exactly what these growths are, why they multiply faster after age 50, what your immune system and gut have to do with all of it, and what a real, evidence-informed daily plan actually looks like. Food, movement, breathing, and topical care combined into one system that works together rather than against itself. I want to be clear before we go any further. I am not your personal physician. Everything here is health education designed to give you a sharper set of questions to bring to your own doctor. Nothing in this video replaces a clinical evaluation, and you should always run any protocol changes past someone who knows your full medical history. What I can give you is a roadmap, and sometimes that roadmap changes everything. Let's start where most people get confused. Not every bump is the same thing, and treating them all the same way is one of the most common, and sometimes dangerous, mistakes people make. There is a category of growth that most people call a skin tag. Technically, these are papillomas, soft, flesh-colored, dangling little stalks of tissue that attach to your skin at a narrow base. They show up on the neck, under the arms, along the chest, and wherever skin folds against skin. These are almost always linked to the human papillomavirus, commonly known as HPV. Now, before that word makes you panic, understand something important. HPV is not one virus. It is a massive family of over 200 related viral types. Some of those types are serious and can drive precancerous changes in certain tissues. But the types behind ordinary skin tags and common warts on your hands or feet are completely different subtypes. Benign, widespread, and carried by the vast majority of adults at some point in their lives. Then there are true warts. Firm, rough, almost stone-like in texture. You find them most often on fingers, knuckles, or the soles of the feet. If you look closely, you may notice tiny dark pinpoints inside. Those are clotted blood vessels that have grown into the wart to feed it. These are also HPV-driven, but caused by different subtypes than the soft papillomas on your neck. Then you have seborrheic keratoses. These are the waxy, stuck-on-looking brown spots that tend to appear in middle age and beyond. They look almost like someone pressed a flake of dried bark onto your skin. These are not viral. They are age-related changes in how skin cells renew themselves combined with cumulative sun exposure over decades. They require a completely different approach than anything HPV-related. And finally, moles, particularly the darker, hanging ones that people often mistake for papillomas. These carry more pigment, sit on a thicker base, and they belong in a strict category of their own. See a dermatologist. Do not treat at home. Any mole that is dark, irregular in shape, or that has changed recently needs professional evaluation. Full stop. The reason this distinction matters so much is simple. Pick the wrong treatment for the wrong lesion and you can turn a minor cosmetic inconvenience into a genuine medical problem. Before you decide what to do with any growth, there is a quick 3-point check you can do at home in front of a mirror. Think of it as a basic triage, not a diagnosis but a starting point. First, look at color. A harmless skin tag or age spot typically holds one even tone, light beige, pale brown, or close to your own skin color. If a growth shows multiple colors, patches of dark, light, red, or near black, that is not a skin tag situation. That is a dermatologist appointment. Second, feel the border. Run a fingertip around the edge of the growth. If it feels smooth and clearly defined, that is more reassuring. If the edge is ragged, blurred, or if the pigment seems to bleed into the surrounding skin, professional eyes need to look at it before anything else happens. Third, think about change over time. If the growth looks the same as it did 6 or 8 months ago, same size, same color, same shape, that is a lower concern finding. If it has grown visibly, shifted shape, or started sticking out more, it needs to be evaluated. A dermatologist with a dermatoscope, a small handheld magnifying device that reveals the internal architecture of a skin lesion, can often give you a confident read in under a minute. That one visit eliminates weeks of guessing and prevents you from accidentally treating something dangerous with an over-the-counter product. Now here is where things get genuinely interesting. and where most health content about skin growths completely drops the ball. HPV is extraordinarily common. Health agencies consistently estimate that nearly everyone who is sexually active will encounter some form of HPV during their lifetime. And at any given time, tens of millions of people are carrying the types that cause benign growths. Most of those people never develop visible lesions at all. Their immune systems quietly contain the virus, and many infections clear entirely on their own. So if HPV is this widespread, why does one person sail through their 50s with clear skin, while someone else starts growing clusters of new papillomas every few months? The answer almost never has anything to do with catching something new. It has everything to do with what changed inside, specifically the strength and efficiency of the immune response that was already keeping the virus under control. 3 biological systems are central to this shift. The first is your micronutrient status, particularly zinc. The second is your gut and the immune architecture surrounding it. The third is your chronic stress level and its downstream effects on your hormones and immune cells. Zinc is a trace mineral that your immune cells depend on for growth, signaling, and repair. When zinc levels fall, even modestly, T cells and natural killer cells lose efficiency. They do not respond to viral triggers as quickly or as powerfully. Published clinical data show that zinc deficiency is common in older adults, partly because aging itself reduces the gut's absorption capacity, and partly because modern diets heavy in refined carbohydrates and processed foods are simply poor sources of this mineral. When zinc stays chronically low for years, HPV that was once kept in check by a competent immune response starts to find gaps. The gut dimension is equally significant. Immunologists have established clearly that the mucosal immune tissue in and around the intestine represents one of the largest concentrations of immune activity in the entire body. The often cited figure that the gut houses roughly 70% of the immune system is a simplification, but the underlying principle is well supported. Gut health and immune function are deeply intertwined. A disrupted microbiome, from years of high sugar intake, excess refined flour, long-term use of acid-suppressing medications, or chronic low-grade inflammation, weakens the very immune environment your body needs to keep viruses like HPV in a dormant, contained state. And then there is chronic stress. When psychological stress becomes a permanent background condition, grinding work pressure, caregiving exhaustion, financial worry, poor sleep that never quite catches up, the body maintains elevated cortisol levels over months and years. Short-term cortisol is protective. Long-term cortisol is corrosive to immune function. Research on psychoneuroimmunology consistently shows that people under chronic stress mount weaker antiviral responses. They have more difficulty suppressing latent viral infections, and many clinicians who work in dermatology will tell you that new waves of skin growths often coincide with periods of prolonged stress, poor nutrition, and disrupted sleep. Consider a patient like Margaret Collins, a 58-year-old woman who had carried a few small skin tags on her neck for years without much change. Then her mother's health declined rapidly. Margaret became the primary caregiver, sleep became fragmented, meals became quick and nutritionally thin, and worry became the dominant emotional state. Over the following year, the handful of tags became dozens. The virus had not changed. Her internal environment had. That story repeats itself across dermatology practices with enough consistency to be instructive rather than coincidental. So the framework becomes clear. If you want to change what is happening on your skin, you cannot address only the surface. You have to simultaneously support the systems the virus is exploiting: micronutrient status, gut integrity, stress physiology, and circulation. Let's walk through each layer in practical terms, starting with food, because it is where many people can begin making changes within the next 24 hours. Pumpkin seeds are one of the most accessible zinc sources available anywhere. A small daily handful of raw, unsalted pumpkin seeds can meaningfully contribute toward your zinc needs, giving your immune cells a more reliable supply of a mineral they use constantly. This matters more with every decade past 40, as gut absorption of zinc tends to decline with age. Fermented vegetables, specifically naturally fermented options like raw sauerkraut, kimchi, or fermented beets, carry live lactic acid bacteria that directly support microbiome diversity. Health authorities that study dietary patterns consistently highlight fermented foods as contributors to a healthier gut bacterial community, and that community in turn supports more balanced immune regulation. The critical point? Naturally fermented in brine, not vinegar-pickled products that have been heat processed. The live cultures need to be intact. Garlic deserves its own explanation because the way most people use it is the way that wastes most of its benefit. When you crush or finely mince raw garlic and then let it sit exposed to air for several minutes before eating, an enzymatic reaction produces allicin, a sulfur compound with well-documented antimicrobial and antiviral activity in laboratory and some human research. If you cook the garlic immediately or swallow it whole without crushing it first, far less allicin forms. The few minutes of waiting time is not a minor detail. It is actually what makes the garlic biologically active. Swapping instant flavored oatmeal for real rolled oats, then adding a spoon of ground flaxseed gives you soluble and insoluble fiber that functions as a prebiotic, fuel for the beneficial bacteria in your gut. Those bacteria respond by producing short-chain fatty acids that strengthen the gut lining and help regulate immune signaling. Cooked beets, a spoon of unrefined oil, and a few spoonfuls of sauerkraut at lunch adds fiber, plant polyphenols, and healthy fats that support both the gut and liver function over time. In the evening, the garlic dose and another handful of pumpkin seeds close the nutritional loop. Zinc, sulfur compounds, and prebiotic fiber quietly doing their work while you sleep. Equally important is what you begin reducing. Added sugar and refined flour are preferential fuel sources for less helpful gut microbes and yeast. Consistently high intake shifts the microbiome in directions that compromise immune efficiency. If you have been on a proton pump inhibitor, a stomach acid suppressant, for an extended period, there is evidence it can alter gastric acidity in ways that affect the gut microbiota. That is worth a frank conversation with your prescribing physician if you have been on one for 6 months or more. A morning habit many people find useful is a glass of warm water before breakfast, sometimes with a small amount of apple cider vinegar. Because vinegar is acidic and can irritate the stomach lining, particularly for people with reflux, ulcers, or gastritis, this is something to only try after discussing it with your doctor. Plain warm water works well on its own for many people. Now let's address stress physiology, because this is the layer most people skip entirely, and then wonder why the dietary changes alone only help so much. You cannot breathe a virus out of your body, but you can absolutely use conscious breathing to shift your nervous system out of the sustained sympathetic activation, the fight or flight state, that chronically elevated cortisol creates. And when your nervous system calms down, your immune system becomes more effective. The technique is diaphragmatic breathing with an extended exhale. Here is exactly how it works. Sit or lie in a comfortable position. Place one hand flat on your chest and one hand on your belly. Breathe in through your nose for a slow count of 4, allowing your belly to rise more than your chest. Hold the full breath for a count of 4. Then breathe out through your mouth for a count of 6, letting the exhale be noticeably longer and slower than the inhale. That pattern, belly-led breathing with a longer exhale, activates the vagus nerve and stimulates the parasympathetic nervous system, the branch responsible for rest, digestion, and immune maintenance. Published research and clinical experience consistently show that slow diaphragmatic breathing with extended exhalation reduces perceived stress, lowers resting heart rate, and improves sleep quality when practiced consistently. 5 complete cycles in the morning and 5 before bed takes only a few minutes, and many people notice meaningful changes in tension and sleep depth within 2 weeks of daily practice. While you are working on the nervous system from the inside, you can also support immune circulation from the outside, specifically your lymphatic system. Unlike the cardiovascular system, which has the heart as its pump, the lymphatic system depends entirely on muscle movement and body motion to circulate lymph fluid. Prolonged sitting, which describes most modern daily routines, slows lymph flow, allows immune debris to linger in tissues, and reduces the efficiency of local immune activity in the skin. A simple corrective is gentle standing trunk rotations. Stand with feet about shoulder width apart, arms hanging loose at your sides, and slowly twist your torso from side to side so your relaxed arms swing freely and tap against your ribs, belly, and lower back. No forced movement, no snapping the joints, just a gentle rhythmic twist and untwist, repeated for about 3 minutes in the morning and 3 minutes in the evening. This repeated compression and release of the soft tissues surrounding your lymph vessels encourages lymph movement and can reduce that mild puffiness many people notice in the face and hands when circulation has been sluggish. Some people add light acupressure to this routine. 2 commonly referenced points are the web of tissue between the thumb and index finger and a small hollow just below the most prominent bone at the base of the back of the neck. Acupressure comes from traditional medicine systems, and while the mechanism is not yet fully mapped by Western research, small studies and wide clinical experience suggest it can ease perceived tension for many people. If you try this, apply mild, steady pressure to each point for about 30 seconds on each side, immediately after your rotation exercise, and stop if anything feels sharp or uncomfortable, particularly around the neck. Now we reach the part of the conversation most people came here for: what you can actually apply to these growths, and what you must never do regardless of what you have read online or seen in comments sections. Dermatologists see the same self-inflicted injuries repeat themselves constantly. Knowing what not to do can genuinely protect you from weeks of pain and permanent scarring. Do not use raw plant saps as burning agents. Celandine, for example, is a strong alkali that indiscriminately destroys tissue. People apply it hoping it targets only the growth. It does not. The result is often a chemical burn that encompasses not just the lesion but the healthy skin surrounding it, sometimes leaving a scar significantly larger than the original bump. Do not tie off growths with thread or hair in an attempt to cut off their blood supply. If the ligature does not precisely catch the entire base, you injure tissue, trigger inflammation, and leave HPV-positive cells behind in the skin, cells that will simply generate new growth in the same location, now in an already irritated and potentially infected environment. Do not cut growths with scissors or blades. You are not removing the virus. You are removing the visible structure while slicing blood vessels, opening the skin to bacterial infection, and smearing HPV-containing cells across the surrounding area. Dermatologists regularly treat infected bleeding wounds that resulted from bathroom removal attempts on growths that could have been handled cleanly in a clinical setting. Do not apply concentrated vinegar directly to skin lesions. The acidity is sufficient to cause deep chemical burns, particularly on the neck, chest, and body folds where skin is thinner and more sensitive. The growth may die. So will a meaningful amount of healthy surrounding tissue, leaving a mark that outlasts the original lesion by months or years. Do not ignore a torn papilloma. When a stalk is ripped by jewelry, a collar, or accidental friction, virus-containing cells are distributed across neighboring skin. That auto-inoculation is exactly how a single growth becomes a cluster. If a growth tears, clean the area gently and let a dermatologist look at it before new ones start appearing. And do not apply the same treatment to different types of lesions. Salicylic acid works on thick, keratinized warts. It is too harsh for soft, thin skin tags. Castor oil is gentle enough for papillomas. It has essentially no effect on a deep plantar wart sitting under a thick callus. Treatment has to match the target. With that clearly established, here is what people actually discuss with their physicians and dermatologists for confirmed benign lesions that have already passed the color, border, and growth change check. Castor oil is the gentlest widely available option for soft papillomas. Its primary active component, ricinoleic acid, has anti-inflammatory and skin-softening properties. When applied directly to a soft skin tag twice daily and covered with a small bandage to maintain moisture and contact, the tissue can gradually soften and sometimes reduce in size over 1 to 2 weeks, particularly for small, recent onset growths. Some lesions respond, some do not. The approach is inexpensive, gentle, and low risk. It is a reasonable starting point for someone whose dermatologist has confirmed the lesion is benign and appropriate for conservative at-home management. For virus-driven warts on the hands and feet, salicylic acid is the evidence-based first-line option in multiple clinical guidelines, including those from the British Association of Dermatologists. Salicylic acid is a keratolytic. It dissolves the thickened outer layers of wart tissue, and it also generates a mild local inflammatory response that finally prompts the immune system to recognize and attack the wart. Studies show cure rates that clearly exceed placebo when the treatment is used correctly and consistently. The critical phrase is correctly and consistently. The timeline is measured in weeks to months, not days. A practical protocol your doctor or pharmacist can help you confirm. Soak the wart area in warm water for 5 minutes to soften the surface. Gently file away the white, dead outer layer using a disposable emery board, stopping before you reach living tissue. Apply the salicylic acid product directly to the wart while protecting surrounding healthy skin with petroleum jelly or a thick barrier cream. Cover the area with an appropriate bandage or wart pad to keep the acid in contact with the lesion. Repeat daily. Many guidelines suggest continuing for up to 3 months before declaring the approach unsuccessful. Anyone with diabetes, significant circulation problems, or immune compromise should not self-manage warts on their feet or hands with acid preparations. The risk of ulceration and secondary infection is too high without clinical supervision. For lesions that have not responded to conservative measures, or that are numerous, large, or in cosmetically or functionally sensitive locations like the face, eyelids, or genitals, in-office procedures are the appropriate next step. Cryotherapy with liquid nitrogen, electrosurgery, and laser ablation all destroy the lesion in a controlled, predictable manner under clinical supervision. Each carries manageable risks, minor pigment changes, small scars, but those risks are known and supervised, unlike the unpredictable damage of improvised home methods. For most people dealing with recurring growth patterns, the most durable approach is a combination: clinical removal for existing lesions, paired with sustained lifestyle changes that address the underlying immune environment, so new lesions appear less frequently and less aggressively. Putting the full system together, a practical daily structure might look like this. In the morning, 5 cycles of diaphragmatic breathing before you leave the bed. Warm water on waking, rolled oats with ground flaxseed and a handful of pumpkin seeds for breakfast. 3 minutes of gentle trunk rotations followed by optional acupressure. Application of your agreed topical, castor oil, salicylic acid, or a prescribed cream, directly to the confirmed benign lesion, then covered with an appropriate dressing. At lunch, your normal meal plus a few spoonfuls of naturally fermented sauerkraut and cooked beet with unrefined oil. In the evening, crushed garlic allowed to sit for several minutes before eating with a meal, another small handful of pumpkin seeds, a short second round of trunk rotations, and 5 cycles of slow belly breathing before bed. None of this is complicated, none of it is expensive, and none of it is magic. It is simply a set of small, evidence-informed daily inputs that support the biological systems already responsible for keeping HPV contained. Micronutrient availability, gut integrity, nervous system balance, and lymphatic circulation, applied consistently over enough time to make a real difference. One final habit worth building: a yearly skin check with a dermatologist. Not because every growth is dangerous, but because one visit per year gives you professional eyes on anything that has changed, catches early trouble before it becomes late trouble, and gives you genuine peace of mind that home observation alone can never fully provide. After age 50, HPV tends to take greater advantage of the natural gradual decline in immune efficiency that aging brings. Clusters of papillomas and other benign growths become more common in the 50s and 60s for exactly this reason. If you have noticed that your skin has changed over the last few years, more growths, growing faster, appearing in new places, that observation is meaningful. It is not cause for alarm, but it is cause for a real systematic response. Your skin is not just a covering. It is a living organ that reflects what is happening inside you. When it speaks, the most useful thing you can do is listen, and then take that information to someone qualified to help you respond to it well. Everything in this video is education. Bring what resonates to your own physician or dermatologist. Let them help you build the version of this that fits your health history, your medications, and your individual circumstances. That is how this kind of information does the most good.